I want to thank you all for joining us to learn about how to maximize your benefits that you've received in your Western Health Advantage MyCare plan. And thank you for joining and trusting Western Health as your Medicare health plan carrier. Today we have with us our host. Let's see if I can get my presentation working. Her name is, please forgive me if I say this incorrectly, Kimberly. Her name is Kimberly Kuwahara, and she is the account manager with Delta Dental and Alliances. Kim, I'll go ahead and hand it over to you.
Okay, sounds great. Well, thank you everyone for joining. I'm going to go ahead and give you kind of an overview of how to access your dental benefits with Delta Dental. If you want to go ahead. Yeah. We're going to talk about who we are in case you haven't heard of Delta Dental, kind of a little overview of the plan details, and the member experience in terms of resources available to you as you navigate through accessing your dental benefits, and then Q&A on any questions you may have. So who is Delta Dental? We are the #1 provider of dental benefits. We're a very large dental company. We have nearly 80 million enrollees. 1 out of 3 Americans have dental insurance with Delta Dental. About 40% of Fortune 500 companies are clients. And we also have a large amount of Medicare business, over 1 million Medicare Advantage members nationally. So we do have that brand name recognition, and dental benefits is our one and only specialty. So we hope that we're really good at dental, since that is our specialty. So we'll go ahead and talk about the benefits available to you with Western Health Advantage. We're pleased to partner with Western Health to offer this benefit to the Medicare enrollees. The plan that you have in place is a DHMO plan. It's a fully owned national DHMO. You're assigned to a general dentist, auto-assigned based on your location, and you can change that provider, and we'll talk about that a little bit later, through customer service or through calling or on our microsite as well. You also can get specialty care through referrals from your primary care dentist, and you must stay in network except for emergency situations. In terms of the plan design, you have predictable co-payments. The co-payments or no co-payments for quite a few procedures, especially preventive care. There's no deductibles, maximums, or waiting periods. Certain frequencies and limitations apply in terms of like how many cleanings you can get or that type of thing, but otherwise you have wide access to the services available. You go ahead and pay the copay for the services when you go to the dentist. And then if you do need a specialist, the primary care dentist will go ahead and do that referral. It does not go through Delta Dental. That primary dentist is managing your care, and if you need to see a periodontist, they will go ahead and take care of contacting that specialist and making that referral for you. So if you do go out of network, that wouldn't be covered. You need to go ahead and stay inside the network with your primary care dentist. Again, except for emergency situations. So dentists are auto-assigned based on the home address. The dentist's name is included in the welcome letter. Hopefully you all have received your welcome letter. All contracted dentists are assigned a unique ID number. If you do want to make changes to your dentist, you can go ahead and do that online, or you can call our customer service call center. Changes made by the 21st of the month are effective on the 1st of the following month. And then if you make it after the 21st, it would be effective on the 1st of the next following month. And there's no limit on the number of times you can make that change. You can try a dentist out for a couple months, and if you decide you don't like that dentist, you can go ahead and change it, and then you can change it again in a month or two if you'd like. So there's no there's no limit on that access to a dentist that you would like to see. Next slide, there we go. So here I'm kind of showing you some of the common procedures that you may be accessing and what your copay is. So as you can see, for quite a few services, especially oral evaluations and x-rays, bite wings, panoramic film, so that would be a complete x-ray of your whole mouth, cleanings, those type of things, you have a zero copay for those types of services. Amalgam, that's a filling, so that copay is $47. And I'm just kind of listing some other services there for you to see. Is that the bottom of it, Denise? I think it is. There you go. And then in terms of some other common procedures like a crown, porcelain crown, your copayment would be $390. Root canals, $229. Periodontal scaling, which is something that especially seniors may be in need of, that would be a zero copay. Complete denture, top or bottom, each of those are $705. So this is a pretty great benefit, pretty rich benefit for that Western Health Advantage is providing for you. Next slide. In terms of the member experience, we provide tools for you, and we try to make it as easy as possible. So as I mentioned, your provider was auto-assigned, or you can go ahead and choose your own dentist by calling or going online. You go ahead and make your appointment, visit the dentist, and pay your copay. It's really as simple as that. You don't have to deal with any paperwork, claim forms, anything like that. It's really pretty easy. Next slide. As I mentioned, if you need specialty care, your dentist will go ahead and do that referral and take care of that request for you. And again, if you need to go out of network for emergencies, you're able to do that as well. ID cards are not required, but we do provide those to new members. So you should have received that ID card with your welcome letter. The letter would also have your have the provider's name so that you're aware of who that dentist will be. So hopefully everyone received those letters at their home address. We also have resources online on the Western Health we call it a microsite. It's like a website for dental. So there's detailed information on the copay schedule, customer service phone number, things like that on the microsite. I'm going to show you a picture of what that looks like on the next slide. But so the dedicated microsite, I'm so sorry I didn't change the name right there. That was for a different client. That is the microsite web address. You can view your benefits. You can find dentists. You can create a login as well. So you can check eligibility, benefits, and claims on our app as well. You can find a dentist by your mobile location. There's also different things on the website, a cost estimator for common services. There's also quizzes, videos, dental health information, just lots of resources for you out there on the microsites. This is kind of a snapshot of the main page of the microsites. So you see, you can kind of search for a dentist. You can, if you click about your plan, you'll get the copay schedule of your benefits, managed costs, all types of things are available here on the microsite for you. This is your toll-free custom number listed here. Customer service support is available to you on the phone. We also have bilingual support and language assistance available if necessary. And customer service is available Monday through Sunday, 8 a.m. to 8 p.m. local time from October 1st to March 31st. And then Monday through Friday, 8 a.m. to 8 p.m. From April 1st to September 30th. So good access to customer service reps who can provide assistance for any questions you have, any questions about a claim, anything like that. If you do have to have a number of procedures, you can go ahead and have your dentist do a predetermination, so you can kind of see what all your co-payments would be for the different services you need, so that you're aware in advance of what you're looking at in terms of cost. So that's available to you as well. As I mentioned, we have, lots of resources. Your oral health is a very important aspect to your health. Next slide, please. Sorry about the dog. Okay. We've got tons of articles, videos, magazines, recipes. We've got risk assessments. I'm so sorry about that. Next slide, please.
He obviously doesn't like the dentist.
And he weighs about 11 pounds. Mason. We've also got short videos and quizzes and healthy aging and tons of different articles about things that affect your oral health. So those things are out there for you. Next slide, please. We also have a newsletter that you can sign up for called Grin, and that comes out quarterly, and that has information about anything new that's out there in the world of Delta Dental and just your basic oral health and all kinds of interesting articles as well for you as well. And that's kind of a summary of your dental benefits. I'm happy to answer questions. Sorry about the dog.
Thank you so much, Kim. So let's see here. Let's see, do we have any questions? I have a question. What if with Western Health Advantage, members can live in one county and choose a primary care in a completely separate county as long as they're in our network? How does that work with Delta Dental?
So we would have assigned the dentist based on the home address, but as I mentioned, you're welcome to go ahead and change that dentist. As long as you do it by the 21st of the month, you'd be able to access that new dentist by the 1st of the following month.
So if I live in Sacramento and I want to assign a dentist, say in Napa, as long as they're in the network, I'm able to do that with Delta Dental.
Right. Mm-hmm.
Great. Okay. And if someone is going to a contracted specialist and they want to charge them more for a procedure than what the copay states they should pay, how should they handle that?
They should call customer service and discuss that. I wouldn't go ahead and do that payment until we see why they'd be charging a different copay that then is what I'm sort of can't talk in the schedule shows.
Right. I've gone through that myself, actually. So thank you. So we do have another question here, Kimberly. Does the dental specialist, i.e. periodontist, have to be a preferred provider with the HMO plan network?
Well, Delta has different networks. So this plan is the DHMO network. So they'd have to be within our DHMO network. So the primary dentist will know what specialists are in the network that are available to refer out to.
Okay, so thank you for that. If that does not answer your question to the person who asked it, just go ahead and let us know, and we'll get in more detail for you. Okay, let's see. Eric or Elissa, are there other questions you might have for Delta Dental?
Not at this time.
Great. Okay, I know this was quick but impactful, and we do appreciate your time today. I want to encourage everyone to, reach out to us if you still have questions, And we are recording this, so it will be on our site eventually. If there's something you missed or want to re-listen to the presentation, you're more than welcome to do so. Give us about a week to 10 days, or we may actually be posting these after the series is done. So watch out for that. And then I want to encourage you to go to the website and register for future webinars. Ones coming up will be True Hearing, so you'll hear all about the hearing aid benefit, the Mom's Meals, which is post-discharge meals available for patients who are discharged from the hospital. And we have our Silver and Fit and Wellness presentation coming up, and then of course a recap on everything. So again, I hope you found this presentation helpful to understanding your benefits a little bit more, how it works. And again, we want to thank you so much for choosing Western Health, and we want to thank Delta for being our partner. If you folks have any questions, please feel free to reach out to us at 888-563-2250. And we will be following up with an email to all of our participants today. If you wish not to be contacted, please put that in the chat box. Otherwise, we're just going to send you a quick email and a thank you for your time again, and make sure that we've answered any questions. Maybe something comes up after we're done here that you didn't think about, and you'll have an opportunity to ask us. Well, Kimberly, thank you very much. Again, we appreciate your time. Love your dog.
Yeah.
And yeah, I know. Don't worry. And have a wonderful day, everyone, and a wonderful week.
Thanks, Denise.
Thank you.